Thank you very much, Bronya, and thank you very much, everybody, either for staying or for coming. My starting point is that we know that personalisation is unequivocally a good thing. It's a golden thread running through policy. It was in the government's vision for adult social care back in 2010, and it's gone through the Care and Support Bill, and it's also very, very clearly set out here in the White Paper last year, Caring for Our Future. There's also a solid evidence base from practice that personalisation delivers clear benefits for people accessing care and support services. There was a survey from TLAP, Think Local Act Personal, out just last month. Over 70% of people who hold a personal budget reported a positive impact on their independence, on their sense of being able to live with dignity, and on their ability to access the support that they needed. And there were other positive impacts on physical and mental health and on the kinds of relationships they were able to build. So we know that personalisation is an absolute good. But the question then arises, okay, so what? How do I make this a practical reality, either in my own organisation, if I'm delivering either residential care or home care, and if I'm a service user, or I'm a relative, or I'm a sort of family member or a carer, how do I ensure that the person I am caring about or caring for has proper person-centred services? So what I really want to cover in this session, apart from a little bit of context first of all about the Skills Academy and why we are involved in this and why we're very passionate about it, is to give you some practical and non-costly tips on what you can do to use tools that are freely available out there to strengthen personalisation for the people you are supporting. So just to start off with, a little bit about the Skills Academy. We have been going for about 3 years, and we have a very clear and specific remit to strengthen leadership at every level of the social care workforce. That's everybody from care assistants, shift leaders, team leaders, registered managers, as well as people working at more senior levels. We reach employers, we reach training providers, we also reach individuals as well. We have over 700 registered managers amongst our members. And we have a very clear remit to develop toolkits and guidance and help for people around leadership in adult social care. So there is an overall leadership strategy for the sector. Leadership starts with me, and something I'm going to come on to talk about in a bit more detail, the leadership qualities framework for adult social care, and this can act as your guide to strengthening both leadership and personalisation in a very practical way. And I mentioned that we were a membership organisation. We have members of all shapes and sizes. We cover all client groups and all areas in England. And we also cover commissioners in local authorities and CCGs. So if you want to get to know someone in social care or you want to be put in touch with another organisation, please come to us. If we don't know them directly, it's a fair chance that we'll know someone who does. Now, moving on to the meat of this. What's the link between leadership and personalisation? Well, it starts from what we think leadership means in adult social care. For the Skills Academy, leadership is not, it's emphatically not just about the strategic leadership at the top of organisations. It's not just the job of the chief executive. You don't get your special leadership cloak when you suddenly become a leadership manager. For us, leadership is all about everyday behaviours, how you behave every day. And it's about being aware of the impact of those behaviours on yourself, on the people using services, on your peers, on your colleagues, on others right across the board. And some things follow from that. Firstly, if leadership is about behaviours, it is everybody's business, Nobody gets off the hook. So if anybody comes to you and says, well, I came into care to care, I didn't come into care to lead, so personalisation belongs with somebody else, it's not the case. You can say to them, leadership and personalisation starts with you. Personalisation is adopting person-centred approaches are behaviours, and they can be developed and strengthened. And I've just put a quote here on the bottom from one of our members, McIntyre. They provide very person-centred services for people with learning disabilities, often quite severe learning disabilities. And their chief executive is very clear that people don't experience our values. We could talk about our values till we're blue in the face. What people actually experience and evidence are our behaviours. Leadership is about behaviours, and adopting person-centred approaches is one of those behaviours. So it's something that you can make practical steps to do something about. And you can have leadership at different levels as well. And so I would encourage you to think about it, first of all, at practice level, thinking about leadership as an issue for all of your staff to ensure that you've got not just the systems but the culture, and the culture above all, in place to promote personalisation. It's about thinking much more collaboratively as well. We know that real personalisation and person-centred planning involves many local services. So this is about coming together in wholly new ways. And if we're talking about collaboration, we're also talking about really listening. That again? That's it. Thank you. Thank you very much. Thank you for letting me know. And just finally, to flag up, this is about community leadership as well, really mobilising people within communities and promoting them as part of community assets, not just thinking about people who use services as recipients of services, but really thinking about people as assets in their communities. And there are things that are available, tools that are available out there in the sector, nationwide, free of charge, ready for you to use. One of them is the Leadership Qualities Framework, which I mentioned earlier. This is a guide to what good leadership looks like. It defines it for people at different levels. So whether you're a frontline staff member, whether you're a frontline leader, a shift leader or a team leader or a first-time manager, whether you're an operational leader or a strategic leader, it breaks leadership down into really simple to follow components. It's written in plain English, so it can be followed by everyone, and it's also applicable in integrated services. It was written with the NHS Leadership Academy, so if any of you have nursing staff, for example, who say, this is nothing to do with me, you know what? Yes, it is. Oops. That's it. And it's very easy to follow. Basically, it breaks leadership down into specific areas, 7 specific areas. We call them dimensions, but they're really just areas of work. So there's something around how you manage services, how you improve services, how you deliver a strategy, how you demonstrate personal qualities. And each of these dimensions has 4 elements, and we break each of these elements down to say, this is what this means for you in leadership terms. So what you can do for personalisation is use the descriptions that relate to personalisation for people at different levels in your organisation. Or if you're a person using services or a commissioner, you can use it to think about your own behaviours and how you leadership and how you develop them. You can build them in as part of supervision and appraisal and performance management and recruitment and selection as well. You can ask about what leadership behaviours people have demonstrated. And there are free online self-assessments for individuals and for organisations, so you can map and track and develop how you measure up to the LQF. And if you do that for a range of your staff, and you notice that there are gaps that keep on appearing in particular places, you can then target your training budget to where it's most needed. And the LQF is mapped to CQC essential standards as well, so you can also use it to demonstrate how you're measuring up as part of the inspection process. It's a really easy practical tool for you. And I just wanted to go through, not in detail, but just a few demonstrations of how this will work in practice and how you can use the LQF for personalisation. One of the dimensions is working with others. One of the subgroups is about building and maintaining relationships. And what the LQF does is say, what this means if you're a frontline worker, you need to invest time and actively build respectful relationships. If you're a frontline leader, you go a bit beyond that. You need to show that they're critical in supporting people to live the life that they want. If you're at registered manager level, you intervene personally to establish these good relationships, and you translate policy and guidance so that it becomes part and parcel of people's experience of personalised care. And then if you're working at strategic level, then it's your responsibility to ensure that the practice and culture of your organisation actively promotes personalisation. So you can get a sense of how it works. It gives you a lever to pull and a benchmark to sort of hang on to and to adapt to your own particular circumstances. Again, encouraging contribution. I won't go through this in detail, but this is all about how you encourage and support people who use services to actually have their say, and how you really promote that culture at all levels of your organisation. So it really permeates your organisation. Again, managing performance, the same kind of thing. Also, this is about continuous improvement as well. So it's about how you encourage improvement and innovation, how you're actively engaged with improving the lives of people with care and support needs, and what that means at different levels. It's about critical evaluation, so you can start to think analytically and conceptually to think about where services can be improved. And it's about also ensuring safety of people, because this can also be a safeguarding issue at the same time. So you can see how it can help you build personalisation right across the board. I just wanted to flag up one thing around an aspect of the LQF in relation to developing networks. This is part and parcel of personalisation, but there is help for people who are registered managers in relation to this. The Skills Academy undertook a survey of all registered managers in England last year, and some of the findings were quite shocking. People, on the one hand, were absolutely dedicated to their roles. People came into social care to make a difference, and registered managers were absolutely committed to providing proper person-centred services as often as not. But the demands of the job have been getting so much greater and so much more demanding over recent years that the stress levels were outlasting the rewards. So we have put together a new national network for registered managers. It will include also bringing together small local networks of registered managers and providing financial support for them, free events for registered managers, online guidance and support, and lots of information. And there's lots of information on the Skills Academy website in relation to personalisation that registered managers can use. I should say, if you'd like more details, please come and see me afterwards. I can sort of point you in the right direction. But I just wanted to flag that up in relation to building and supporting networks, because registered managers are the lead professionals and they deserve much more support. And finally, even if you don't use the LQF at all, or you don't want to use anything like that, and you don't want your registered managers to be involved, there are other things and other approaches that can help build personalisation. We would say thinking about recruitment and selection, and recruiting and selecting for social care values is incredibly important in getting the right people into place first of all. And we're hoping to launch an online toolkit free for employers next month, precisely to help you do that. Do think of leadership development as being for everybody in your organisation. You haven't got a select cadre of leaders. Everybody can do something. We know that focusing on coaching approaches and continuous improvement really pays dividends. And we also know that measuring something, it doesn't matter what you measure almost. You don't need a big research grant, you don't need to be scientists, but measure something. Measure some aspect of how person-centred your services are. And the very act of measuring will help you enormously in really building that culture of person-centredness. And finally, I just wanted to make a plea. There is some wonderful, wonderful person-centred work and services and activities out there. We need to celebrate these much more. So please, please, do put people in for all the awards that are out there, the Great British Care Awards, Skills for Care accolades. There are a number of regional care associations which run their own awards. Please champion and celebrate the people in your organisations who are delivering great person-centred care. Because social care, we should always remember, is a great sector. Dame Denise Platt, when she was recommending a Skills Academy back in 2007, always said, and I always think this is the starting point, social care, when delivered well, has the power to transform people's lives. That's the starting point. That's why we're talking about personalisation here today, because we want to transform people's lives, and that's what social care can do. And the best of social care does that, and we need to champion and celebrate those who do. So just to sum up, leadership is about behaviours, so everybody can do something about this. And building in person-centred services is one of those behaviours that you can do something about encouraging. You can use the leadership qualities framework to instill and embed the right behaviours and really strengthen that culture in your organisation. There are lots of free online and other tools available to help you. Do have a look at the Registered Managers Network, and you can champion personalisation throughout your organisation and through celebrating great social care. I think I'll stop there, and thank you very much indeed.